You ready to get
শুভ
started?
সন্ধ্যা।
Ma'am?
আমরা এখানে উপস্থিত আছি কাছাড় ডিস্ট্রিক্টের আসামের কাছাড় ডিস্ট্রিক্টের শিলচর শহরে ঘুঙ্গুর ক্লাস্টার, যেটা কি শিলচর আরবান এডুকেশন ব্লকের আন্ডারে আছে। এখানে উপস্থিত আছে ঘুঙ্গুর ক্লাস্টারে বিভিন্ন স্কুলের ছাত্রছাত্রীরা, শিক্ষক শিক্ষিকা বৃন্দ এবং সিআরসিসি। আমরা আজকে নিজেদের খুবই ভাগ্যবান মনে করছি। আমরা নিজেদেরকে যুক্ত করতে চলেছি বিন্দু এনজিওর সাথে। বিন্দু এনজিও ন্যাশনালি রিকগনাইজড এনজিও। তাদের মূলত কাজ হলো কাগজ অপচয় বন্ধ করা, ইনক্লুসিভ এডুকেশন বাস্তবায়িত করা। এই সবের সাথে ওনারা বিভিন্ন ধরনের কর্মসূচি সারা বছর ধরেই ওনারা পালন করে যান। এই অতিমারির সময় বিন্দুর কিছু কর্মসূচি পালন করছেন। এই প্যান্ডামিক সিচুয়েশনে ওনারা কিছু বিশেষ কাজ পালন করে যাচ্ছেন। তার মধ্যে যেমন জরুরি তথ্য সরবরাহের জন্য ওনারা 24 ঘন্টার মধ্যে 24 ঘন্টায় হেল্পলাইন নম্বর চালানো, কোভিড যোদ্ধাদের সহায়তা করার জন্য অর্থ সংগ্রহ এবং বিভিন্ন ধরনের সচেতনতামূলক কর্মসূচি। আমরা আশা রাখছি, আমরা আশাবাদী, আমরা ঘুঙ্গুর ক্লাস্টারের শিক্ষক শিক্ষিকারা এবং ছাত্রছাত্রীরা আজ আপনারা যে কর্মসূচি আমাদেরকে ফার্স্ট এইডের যে আমরা একটা ট্রেনিং নিতে যাচ্ছি, আমরা খুবই আশাবাদী যে আজকে আমরা নিশ্চয়ই উপকৃত হব। আমাদের মধ্যে যে কচি কাঁচা বাচ্চারা আছে তারাও ভবিষ্যৎ জীবনে এই ট্রেনিংটা ওদের কাজে লাগবে, সেই আশা নিয়ে আমরা এগিয়ে যাচ্ছি। আমি আমন্ত্রণ জানাচ্ছি শ্রদ্ধেয় দেবাশিস চক্রবর্তী স্যারকে, সেক্রেটারি অ্যান্ড ফাউন্ডার অফ বিন্দু, এবং হেমন্ত মাঝি, অ্যাসিস্ট্যান্ট সেক্রেটারি অফ বিন্দু। আপনাদেরকে সমস্ত ঘুঙ্গুর ক্লাস্টারের পক্ষ থেকে হার্দিক অভিনন্দন জানাচ্ছি। এখানে আরেকজন ম্যাডামকে দেখতে পাচ্ছি, নাম ঠিক আমি বুঝতে পারছি না, এখানে কিম মুরে আসছে। ম্যাডাম, you are cordially invited, you are cordially welcomed on behalf of entire Ghungur cluster. I am welcoming you. So স্যার দেবাশিস স্যার এবং হেমন্ত মাঝি স্যার, আপনাদেরকে আজকের বিষয় নিয়ে কিছু বলুন এবং আজকের প্রোগ্রামটা শুরু করুন আপনারা।
So every time you see 911 in one of our videos, that means call your emergency medical service. So I don't know if you have the same number for your whole country or if it's different in different parts of the country, but we can certainly put that in there. So 911 is the number that we call throughout the entire United States. So that's why you'll hear that sometimes. Now I gotta figure out how to do that. tab. All right, so next is anaphylaxis, which can happen right after an allergy attack, but it can just happen for any other reason too. So somebody that has severe allergies can have them so severe that they have trouble breathing and can even stop breathing. So that is what anaphylaxis really means, that it's a very quick allergic reaction. It usually has really intense hives or swelling, and then it involves the head, neck, or throat. And if we don't do something about it right away, then that person can stop breathing. So let's see if I can get this other picture. So here is all of the symptoms of anaphylaxis, and you can see there's quite a lot. So it's a big word, but it's talking about a serious allergic reaction that can happen pretty quickly. It can happen within 10 minutes. It can also happen slowly, but it's generally a very quick thing. So if a child is allergic to peanuts and they accidentally eat some peanuts, or even sometimes the dust from the peanuts, or somebody else touched peanuts and then touched them or their food, sometimes the allergy is that severe that you can't even be around it, then any of these things can happen. Anxiety, swelling, especially of the face, stomach problems, nausea, vomiting, diarrhea, the hives on the skin, rashes, itching, and then the circulation. You can have fainting, a high heart rate, feel like you're passing out or pass out. And then the red box is the most serious, the trouble breathing. So go back to the other one. So the treatment for anaphylaxis is to give an Epipen. That stands for epinephrine, and it looks like a pen. Now, there's lots of different brands, and there's different ones in different countries. So this is a really popular one that we have in America, but we also have ones that look like little boxes and things like that. But the point is that there's a needle in it, and epinephrine is a liquid drug that we are going to give as a shot right into the leg. So if someone knows that they're very allergic, and I'm someone that I have some allergies to some foods, like tomato, I can't have any tomato at all, or I stop breathing. So I have an EpiPen, and if it ever happens by accident, which it has happened a few times, I have to get the EpiPen and basically stab it down into my leg. So I'm going to just show you a little.
Designed to go through clothing, including jeans, because it must be injected into the outer thigh for quick absorption. If you're helping a young child, like me, hold the leg firmly in place. Once it is, you just do this. Boom. It clicks, so you know it worked. Then you hold it there for 3 seconds.
Then, remove Epipen.
You'll still see some liquid in there, but don't worry, your Epipen Junior auto-injector gave you the right dose, and it has a special feature, the never-seen needle.
Yeah, so the needle's totally covered up, so you should never see the needle.
Then rub the spot for 10 seconds while you or someone else gets emergency medical help right away. Call the ambulance! Or have someone take you to the emergency room. Just make sure to do it immediately.
And you should always carry 2 Epipen auto-injectors.
So just real quick, it was just showing you, we really just stab it in the leg, and the needle will come through really quick. You really don't feel the needle at all, and it goes right through clothes, even jeans and things like that that are thicker. And you should still get medical help calling your emergency number or ambulance. So the next one I want to show you about is diabetes. We're going to talk about a few things here. This slide is showing if someone already knows they have diabetes, it could be an adult or a grandmother or something like that. They can have signs of low sugar, which means they don't have enough sugar in their body. And when you have diabetes, that's a disease that doesn't regulate your sugar correctly. Okay, it can be too high or too low. So the dangerous one is when it's too low, because that can happen very quickly. And the problem is when it goes very low, then someone could pass out or even have a seizure. So if we see the signs of it when it's first starting, they will not feel good, dizzy, shaky, maybe a little sweaty, confused. But you see in the picture, there's an ID bracelet. A lot of people with diabetes will wear some sort of jewelry or identification in case they do pass out, so that our emergency helpers know that they have diabetes and can get them some sugar. Here they're eating some raisins or some sugar tablets. Sugar tablets are things that we can just buy in a drugstore, but you can just have cubes of sugar. Some other things to give right away if they're able to drink and eat still, they're still sitting up and able to talk to you, is a soda or a juice or any drink with sugar in it. And we have to be careful. Now, a lot of our drinks here where we are diet drinks. So they have, or they're sports drinks or they're healthy drinks. But America eats a lot of sugar, so they're trying to cut out sugar now. So they're still selling a lot of drinks, but they have the sugar substitutes in it. So that you have to be careful of because it could look like, it's a pink drink. It looks like it would have sugar in it, but then it really has 0 sugar in it if you read the label. So we have to be careful of that. But any other drink that's not water or a diet soda will help. It'll have sugar in it. And then if you do have the sugar cubes or the glucose tablets, which means sugar, that you can actually buy, or any small piece of candy like a jelly bean, or we have little candies called Smarties. They're just little circles of candy. Just any candy will be fine there. Now that's for somebody that already has diabetes. So what would young children or teenagers be looking out for to make sure they don't have diabetes? First of all, we have 2 types. We have type 1 and type 2. Type 1 is often called juvenile diabetes because that's when you find out you have it, either a very young child or even up through teenager, basically. If you find out as a child that you have diabetes, that means you will have it for the rest of your life. And it's a little bit of a different kind than type 2 diabetes. Type 2 diabetes is something that we all can get later in life, and it's based on how healthy we are with exercise and food. So these are some signs as a child to notice if you might have diabetes. And this just means you need to go to the doctor and get a blood test, and they'll be able to tell you. So always hungry, always thirsty, always going to the bathroom, like peeing a lot, super tired, losing weight. And the last one there, wounds healing slowly. So like if you get a cut on your arm, and normally that would have a scab and heal up in a day or two, and you notice like a week later, like, why do I still have this cut on my arm? It's just not going away. That's another sign. But the thing we see most often with young kids is the always thirsty and just having so much pee or urine, like they go to the bathroom every hour or two, and it's like a lot, and they're like, what's going on with this? So that's one of the signs. Now, looking at diabetes, if you're older, the type 2 diabetes, this is people that are at higher risk. Over age 40 means you have a higher chance than when you're younger for type 2. If you're male, you have a higher chance of getting it than a female. If you have a relative with diabetes, you have a higher chance. So that's like if your mom has it, or your dad, or your grandparents, aunts and uncles, brothers and sisters. If they are blood relatives related to you, then that means you have a higher chance of getting it. So it just means you have to look out for it. If you have high blood pressure, you can have a higher chance. And if you are not physically active. So it's important for everybody, whether you're worried about diabetes or not, to keep your body moving and make healthy food choices. So here's a very short clip, and then we'll look at this one about pre-diabetes.
Hi, I'm Joan London. More than 84 million Americans are at risk of developing type 2 diabetes, and many do not realize that they have the power to prevent it, or at the very least delay its onset. The National Diabetes Prevention Program teaches people with the condition known as prediabetes how to make simple lifestyle changes that can make all the difference. Hi, my name is Georgine Barstow. I'm a registered nurse, personal trainer, and a lifestyle coach for the National Diabetes Prevention Program. So that's the natural process of your blood sugar and your A1C. I teach participants life skills to reduce the risk of type 2 diabetes. If you're at risk for type 2 diabetes, it is very important to increase your physical activity. Most people need to start slow. Get motivated by doing something you enjoy. Here are 5 simple steps to get moving. Number 5, exercise while you watch TV. You can do arm or leg lifts. Simple weights or canned goods can be used. Number 4, take the stairs. Start slow. It raises your heartbeat and builds muscle strength. It also works your lungs and waistline. Number 3, go outside. The world is your gym. Explore. Do things you enjoy. Discover a new park, play catch, bike. Spending time outside raises your levels of vitamin D and puts you in a better mood. Number 2, dance around your home. It is a great form of exercise and fun. You can burn 300 calories in just 30 minutes. Number 1, walk. Do it alone or with a friend, anywhere, anytime. It is the ideal low-impact exercise. 30 minutes a day makes a big difference. Along with better nutrition, these simple steps will help you reduce the risk of type 2 diabetes. If you are at risk for type 2 diabetes, you can work with a dynamic lifestyle coach like Georgine at a National Diabetes Prevention.
Okay, so they were showing a few examples of healthy moving, and that's also something I could talk about for an hour on another session, is picking healthy moving exercises and ways to move your body, and also making healthy food choices, picking natural foods, the fruits and vegetables and grains and protein, whichever way you get that, and instead of processed foods. That's the best way to eat healthy. The next one we're going to look at is heat exhaustion and heat stroke. And this means if we're outside and just it's hot out and we're not able to cool down. So the body normally cools by sweating. If you have a problem with sweating, some people do have a medical condition and they have trouble with that. That would cause a problem. But the most common thing is here we see high humidity can affect our ability to sweat. And also just if you're outside too much, or if then you add exercise outside, if you combine things together, or you're not listening to your body when you start getting those warning signs, that's when the danger can occur. You'll actually get a high body temperature, and then that can damage the organs, including the brain. So people that are more at risk for this are elderly, the very young, are preschool age kids, people with obesity, or if you have a fever or dehydration or heart disease, mental illness, poor circulation, if you already have sunburn, or some prescription drug use or alcohol use. There are some antibiotics, for example, that your doctor might prescribe for just a regular infection that you have, but they make you more sensitive to heat. That's called photosensitive, talking about the sun, and that can make you feel the heat quicker than normal. So here is a chart of what to look for and what to do. So if you start at the bottom with this, you see that the arrow goes up. So look at the bottom first. For heat cramps, it's just getting any pain in any muscle that you have and a lot of sweating. So you're trying to do your exercise class outside, or you're going for a hike in the woods or something like that, and it's just harder than normal. That just means listen to your body, take a break, make sure you're getting shade or going to a cool place, and drink lots of water or a sports drink. Excuse me. So the next level is heat exhaustion. So that means exhaustion means you're super tired. I can't get up and get out of bed. But we're talking about that the heat is making you feel that way. So again, it's most often the sun, but it can be other things. You could be inside working out in a very hot building, or doing some work, or your job is that you are building things outside on a roof, or even if you're inside, if you don't have air conditioning and you're just getting all of that heat build up once it gets 80, 90, 100 degrees, which for us that's in Fahrenheit, would be way too hot. So very sweaty, but then you start to feel sick, nausea, vomiting, fast pulse, tired, dizzy, headache, and might even pass out. So that's really the sign that you need to listen to. And if you see this happen to someone and they are sweating, and you're either outside and it's very sunny, or you're inside and it's very hot and you don't have any fans going, then we need to immediately find a cool place. Make sure you're not wearing extra clothes like a jacket, and you can even take off extra clothes if you have 2 layers on, and take off your shoes and just try to get more skin exposed to the air. And then that's when we're going to start cooling the person, giving them wet cloths or splashing water on their face, or if they're able to go inside and rinse off in the shower or something, that is helpful too. So the worst one is heat stroke. And I remember that because a stroke is normally, we are talking about the brain, which can cause death. So heat stroke is the one that can cause death. So these go in order from heat cramps to heat exhaustion to heat stroke. And so this is where it's actually making the body temperature at a dangerous level. And for us, that is 103 degrees Fahrenheit. And the skin, now we are stopping the sweating. We've gone past sweating, and we're just hot, red, dry, things like that. Let me see what that is for you guys in Celsius. 39. So if you're heading 39 to 40 degrees Celsius, then that is too hot for sure. So if I am a nurse at sporting events, which I do, sometimes working at a run, people are running 5K outside in the heat, whether it's morning or afternoon, you can get too hot when you're running that much. So we'll actually take their temperature, because if your temperature is going up, then that's a problem. So we really need to treat this one like an emergency. If they stop sweating and really start feeling sick, nauseous, throwing up, and have a headache, and then start getting confused, and it happens pretty quickly within a minute or two, that's when we need to put them in an ice bath, or just throw them in any water you have, a lake, a shower, doesn't matter, with their clothes on, we just throw them in, because that's an emergency. If we don't cool them down and cool their body down, then they could actually get brain damage or die. So that one is very serious. The next one we're going to look at is burns, and we're going to do the little quick video first, and then we'll talk about the different type of burns. And this one, hold on, I'm going to find it first. There we go.
Burns can be caused by contact with extreme heat, chemicals, radiation, or electricity. Burned areas can appear red, brown, black, or white. You may see swelling, blisters, or both. To care for any type of burn, remember 3 simple steps: stop, cool, cover. After sizing up the seam, stop the burning by eliminating the cause of the burn if it is safe to do so. Next, cool the burn using cool or cold clean running water for at least 10 minutes. Finally, cover the burn loosely with a dry, sterile dressing. Burns involving blistering or broken skin should be evaluated by a healthcare provider. Some burns are minor and require only first aid care, but others are critical and require a call to 911 or the designated emergency number. To decide whether a burn is critical, look at the following factors. What caused the burn? Burns caused by electricity, chemicals, nuclear radiation, or an explosion are considered critical burns. How deep is the burn? Burns can affect only the top layer of the skin, or they can extend through the deeper layers of the skin or the fat, muscle, or bone underneath. The deeper the burn, the greater the severity. How much of the person's body is burned? A burn that covers more than one part of the body or covers a large percentage of the person's total body area is considered a critical burn. Where is the burn located? Burns in areas where they could impair function or the person's ability to breathe, such as the head, neck, hands, feet, or groin, are considered critical burns. How old is the person? If the person is younger than 5 years or older than 60 years, consider the burn critical unless it is very minor. If you think that a person has a critical burn, call 911 or the designated emergency number immediately.
I'm not used to the Google. I usually use Zoom, so I'm trying to get used to this here. Okay, so back to burns. They talked about some different types, and that what you need to do is to cool right away. So we need to stop what is burning the person and cool it right away, and then get emergency help. So first degree is sunburn, and that's something those of us with very white or pale skin, we can get sunburn just going out in the sun, so we're going to wear sunscreen every day. The darker your skin is, you do get more protection from your melanin with the sun, but that's not always the case. You can still get sunburn even with darker skin, so generally how darker you get or if you get sunburn. So some people just burn all the time and don't ever get darker or tan, and some people have a little bit more natural protection with that. But you can get even a 2nd degree burn from the sun. So that's the number 2, hand, where it would get red and then get blisters, or when it peels and even has a little clear liquid in it, that is a 2nd degree burn. So that means you're burning into that 2nd level of skin. So with the 1st degree, if it's a small area, you can just run the cold water on it and wrap it and use any cooling creams that you have, or ointments, like we use aloe vera or whatever natural things you have, plants that you want to put on it. 2nd degree, also if it's a very small area, you can do that. Anything larger than that, or if you have 3rd degree, you definitely have to see a doctor. 3rd degree means it's gone through those top layers and the middle layers, which are called the epidermis and the dermis, and that will be a different color than your normal skin. So it will look like a burnt piece of wood, basically, with the white char or black charred areas. it won't look like skin anymore. So that definitely needs medical attention. Sometimes at that point, like if people might accidentally fall into a campfire. If you burn your hand or your arm and actually burn through those areas, you've burned through the nerve endings, and sometimes you don't even feel the pain, and you look at it and you're like, oh, that's weird, it doesn't hurt. It's still a very bad burn and won't heal correctly unless you see a doctor and get some medication for that. So next, we're going to take a look at some of our musculoskeletal injuries. So our most common for kids, strains or sprains, those are for muscles, and any broken bones. So that's just running around and playing, or you're jumping off of something, or whatever you're doing on the playground or playing around, or even playing sports like soccer, football, things like that. Having any kind of accident and then your ankle hurts or your foot hurts or you fall down and your wrist hurts. The first thing we're going to do is, if it looks okay and we just have some bruising and it hurts, maybe a little swollen, we use this acronym RICE, which is rest. So don't use that body part until it's healed, which can take a week or two. Immobilize. So if your arm hurts, we can put it in a sling, or if you've really twisted your ankle, you might need crutches, and we might wrap that up with a bandage. Cold is for keeping ice on that. You can put it on every hour if you want to, just not constantly. And then elevation is the E. So if we hurt our arm, we might keep it up on a pillow, and then if you hurt your ankle or your foot, you would try to sit down and even get another chair and keep it up in the air, and that will just help it with the swelling. Anything more severe than that, you would need to go to the doctor or the hospital. So if you have a bone that is broken, or it just hurts more than anything has hurt before, you definitely want to get that checked out. Cuts, we wash with soap and water and just put a Band-Aid on. And for a nosebleed, if you haven't seen this before, some people get them just from allergies and having dry noses and living in dry areas with not a lot of rain. But sometimes it's just you get hit in the face. You could be playing football and the ball just hits you right in the face. So what you want to do is sit up straight and even leaning forward. When I was growing up, we would lean back, and we found that just runs blood down your throat. So we don't do that anymore. So you want to lean forward. And as a nurse, if I have kids at school or camp, I'll just sit them forward in a chair and even put a trash can on the floor right in front of them with some towels or Kleenex, and then they can wait a few minutes for that blood to stop. So it can seem very scary because it bleeds a lot, but it's usually not a big deal at all and will stop on its own. So we do have to call or send the child or person to the hospital if it does last long, like 15 minutes. And also I've had situations with sports where a body or a ball hits the nose, and when it breaks the nose, that can actually cut the artery, and you see blood shooting out. That is an emergency, and so we don't wait with that. We'll just go right to the hospital. You can put ice even right here, if you can see. So it's not the nose that it's actually bleeding. It's just where the blood is coming out. The bleeding is coming from this artery that comes up through your face. So that's why you don't have to put ice even right on your nose. You can put it right here, and that will help you out. So talking about bleeding, any cut that you have, if you have gloves, you should put them on first. Sometimes we will just grab our gauze or your towel and put it on and ask the person who's hurt to hold it, and then we'll wash our hands, put our gloves on, and get more bandages if it's a big cut. The rule with bandages, if we have heavy bleeding, is not peeking under there to see what's going on, because we want it to clot and stop bleeding. So if we're holding a bandage on and then we see that bandage get soaked, we're just going to put more bandages on top. And again, this same 15-minute rule, bleeding should stop on its own. But if it ever doesn't past 15 minutes, or it is shooting out, then that means that's an artery, and that's very severe bleeding that's not going to stop on its own. All right, we have a small video for this one, and this one does have fake blood in it, so just letting you know on that. Oops, that's not the right one. Window, there we go. Okay, so fake blood.
To care for someone with an open wound, begin by covering the wound with a sterile gauze pad and applying direct pressure until the bleeding stops. If blood soaks through the first gauze pad, put another one on top and press harder to apply more direct pressure. It may take several minutes for bleeding to stop. Do not remove any gauze pads. If the bleeding does not stop, call 911 if you have not already done so. Continue to care for the person and monitor for shock.
So I'm going to check your circulation, okay? Okay. I need you to replace my hand right here. Very good. Just like this? Yeah. Okay.
Once bleeding is controlled, check for circulation beyond the injury. Note the temperature and color of the skin and ask the person if there is any tingling or numbness.
Any numbness or tingling of any kind?
No.
So I'm just going to get a bandage. Okay, but you just hold that for a moment, all right? Okay.
Place the end of the bandage on the dressing at a 45-degree angle. Continue wrapping the bandage over the dressing.
It's done.
Once the dressing is covered, roll out the remaining length of bandage. While holding the bandage, use the index finger of the other hand to split the bandage in half, moving it down and underneath the limb. Bring up the two ends of the bandage and tie them in a bow or a knot.
So I'm going to check your circulation again, okay?
Okay.
Check again for circulation beyond the injury. If there is any change, the bandage may be too tight, and you will need to carefully loosen the bandage.
Feel any numbness or tingling or anything like that?
No.
After the bandage is appropriately applied, remove your gloves and wash your hands.
And this is a critical condition. It's a drop in blood pressure. It can be caused by blood loss. It can be caused by the heat stroke. It can be caused by the anaphylaxis, poisoning, severe burn, trauma, even emotional problems can cause shock even, watching something traumatic happen or even going to a funeral. So it just means we're not getting enough blood to the organs or the head or the brain, and the oxygen is in the blood. So it's just this sudden lack of oxygen. And they just look like they're going to pass out. They're going to feel cold and clammy, pale skin, bluish or grayish, be breathing fast, heart rate fast, nausea, vomiting, very tired, and can pass out. So we have a very short clip of shock.
Welcome to the lesson on shock. In this video, we will discuss causes, signs, and symptoms of shock, and how to take care of an individual experiencing shock. Shock can be caused by overwhelming infection, blood loss, severe allergic reaction, severe dehydration, or heart problems. When blood flow is significantly reduced, the body does not receive an adequate supply of oxygen, and shock occurs. Individuals experiencing shock may lose consciousness or fail to respond. Signs and symptoms of shock include poor skin color that is pale, gray, or bluish, dizziness and lightheadedness, nausea or vomiting, behavior change such as agitation, confusion, or unresponsiveness, and clammy skin. When you are to take care of someone suffering from a shock, you should first call 911 EMS. Then help the individual lie down and elevate their legs. Cover them with blankets to keep them warm. Be prepared to perform CPR and stay with the individual until help arrives. This concludes our lesson on shock. Next.
And next, we're going to look at CPR. And CPR, of course, is something I can talk an hour about. There are a lot of skills for this. But the overview is, first, we make sure that the scene is safe, really, for any of these situations, which just means, is the person hurt, or did they collapse on their own, or is there something else going on dangerous? Then you want to wait a bit and not run in and help and call for help instead. And then we check to see if they are okay, which is tapping the shoulders and saying, hey, are you okay? And then we call for help. We call for ambulance or emergency medical providers. And if you have an AED in any building that you're in, or if it's nearby, you can send someone to get that, because those are also very helpful in saving lives. Next, we check to see if the person is breathing. If they're breathing or responsive or both, we can call for help and just wait with them and monitor, because we don't know why they passed out. We don't know if it's shock or low blood sugar or whatever. So if you do have a clue what it is, you can work on that. But if we don't know, we're going to wait for help. But if we figure out that they're not breathing, we're looking at them and they should look like they're just sleeping, and you should be able to see some breathing going in and out, whether it's their mouth or their chest or their stomach. And if you don't see anything happening over a few seconds, then that means they're not breathing. Then we're going to start with chest compressions right away. And the ratio to work on teenagers and adults is 30 chest compressions and 2 rescue breaths. We continue at that rate. You can switch providers every 2 minutes if someone else knows how to do CPR. Otherwise, we're just going to continue until help arrives, basically. Or if we would see signs of life, if you're taking a break and you see the person moving around or breathing, or if something else happens and it becomes more dangerous, the scene becomes unsafe, or if you're too tired to continue, if you have been by yourself and it's been a long time, like more than 20 minutes. So we're going to take a look at our CPR video.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive.
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. For a child, push down about 2 inches. And for a smaller child, you may only need to perform chest compressions with one hand. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a past neutral position. For a child, you'll only need to tilt the head to a slightly past neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and 6.
You have performed 5 sets of CPR on a child. You are alone and need to call 911. EMS personnel take over. You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2 and 3 and 4 and 5.
Super quick overview of CPR, and then our last topic today is choking. If someone is choking, that means they're coughing and they're probably trying to signal or grab their throat and let people know that they're choking. So if we can hear coughing or they can speak at all, even if it's one word or two, or we hear any noise, can be a high-pitched noise or squeak, that means that air is going through. So if there is noise, then they are breathing. So at that point, we don't intervene and we encourage them to keep coughing, help them sit up in a good position, get their head forward, and just kind of assist them and encourage them to keep coughing. When we intervene is when they no longer can make noise. So they might be going and then going. Now they really can't breathe at all and we don't have much time. So that's when we intervene and do abdominal thrusts. And this is a very short clip to just show the hand placement.
Let the choking victim know you're going to help them. Wrap your arms around the victim and make a fist with one hand and place it above the navel in the middle of the belly. Hold the fist with your other hand and press forcefully into the person's abdomen and up toward the chest. Continue performing abdominal thrusts until the obstruction is removed or the victim becomes unconscious. If the victim becomes unconscious, lower them to the ground and begin CPR.
Now, just going to show you our website and how you can take the CPR course for free. So this is our website, savealife.com. and it is, let me just click on this regular one. So it's NHCPS, and I think I can, yeah, put this in the chat box. So there is the website, and how this works is the whole CPR course is on here, and you want to just look in here and pick this one that says CPR, AED, and first aid certification. These other ones are for healthcare providers. You go through the course, will be much more detailed. It covers all the topics I went through, but a lot more videos and reading to go through, and it's all online. And then when you're done, you take a test, and you don't have to do it all at one time. You can finish it on a different day. And once you pass the test, you will be able to instantly download your provider card and certificate. So it's a really nice resource. That's not that one. So let's pick CPR. The code works on this one here in red. It just says CPR, AED, and first aid, not this CPR for life. So you can see it's normally $59, but we're going to use this code, DF CPR Web 100, and then it goes down to $0. So I'm putting that code in here also. And DF stands for Disc Foundation CPR Web 100, just so you're typing the right letters, but you can also just copy that, and I will also email Deb, and he can send it to anyone that would like to do that. We also have the free resources on here, different practice tests. There is a mobile app. This is free on the App Store. It's called Medicode, and it has all the courses. And then you can look anything up. You could have a burn and say, oh, I don't remember what to do. And then you would have it right on your phone, and you'd be able to look that up. And then also we do have free books. So you can download this whole book. I helped write this. So this is 50 pages. It's color. And it has, again, all of the first aid topics, all of the CPR and AED topics for all ages. And then you could either keep that as a file on your computer, or you could print it out somewhere if you wanted a color copy of it. So we did just go through a lot that took an hour. I do have the quiz. I can send it to you if you want to send it to the kids for later. Since we took a while, and also I can see if there's any questions about anything. Oh, I can't hear you. Can't hear you. Do you have mute on? Let's see.
Am I audible?
Oh, there we go.
Oh, yeah. Thank you. Am I audible to you right now?
What's that?
Can you hear me?
Yes. Yeah.
Okay. Just to communicate with them in vernacular, আপনারা যদি চান তাহলে কোনো প্রশ্ন করতে পারেন ম্যাডামকে। আর আমি রিকোয়েস্ট করবো সবাইকে একবার ক্যামেরাটা অন করতে, তাহলে একটা গ্রুপ ফটোগ্রাফি আমাদের হয়ে যাবে। সবাইকে রিকোয়েস্ট করবো যদি একবার আপনার ক্যামেরাটা অন করেন তাহলে গ্রুপ ফটোগ্রাফি হবে।
সবাই ক্যামেরাটা একটু অন করুন। রাজলক্ষ্মী ক্যামেরা অন করো। এখানে যারা উপস্থিত আছেন সবার ক্যামেরা অন করুন, ওনারা একটা ফটোগ্রাফ নেবেন। রাহুল দত্ত স্যার, দীপ্তনু, যোগেন্দ্র স্যার, চম্পক সাহা স্যার, সবাই একটু ক্যামেরাটা অন করুন। তনুশ্রী, স্নেহা, চম্পক সাহা স্যার, দীপ্তনু,
ওনারা মনে হচ্ছে খুব একটা ইচ্ছুক নয় ক্যামেরাটা অন করতে। ঠিক আছে, আমরা আর এটাকে বেশি লিঙ্গার করব না, ওনারও একটা সময় ব্যাপার আছে। Thank you, Kim, for your precious time. It has definitely been a knowledgeable program. And Miss Sandeepa, the coordinator of this particular program, she has of Ghungu, in which we are participating right now. She has been a great help to us. Miss Sandeepa, would you like to say something to her?
Thank you, ma'am. On behalf of entire Ghungur cluster, we are really blessed enough to such a precious training. So I hope all of us will be definitely benefited. And thanks again on behalf of entire Ghungur cluster.
You're welcome.
Okay, thank you very much, ma'am. If you wish, you may leave. We'll just discuss with them the feedback from our end. I'll get back to you soon, ma'am, regarding the next program. Thank you very much, Kim. Thank you very much. Have a good day. Bye. সন্দীপ ম্যাডাম, আমি জাস্ট আমাদের ফিডব্যাকটা আমি শেয়ার করছি আপনাদের সাথে, যাতে করে এরা ফিডব্যাক দিতে পারে। হেমন্ত এখানে আছো?
Actually, all of us are facing very low network issue here.
হ্যালো, সবাই শুনতে পাচ্ছেন? হ্যালো,
হ্যাঁ শুনতে পাচ্ছি। হেমন্ত মাঝি স্যার বলুন।
শুনতে পাচ্ছেন?
হ্যাঁ
আচ্ছা, আমি আপনার হ্যাঁ নমস্কার। হ্যাঁ বলছি, ইনকল মেসেজ বলতে আমি যে লিঙ্কটা দিয়েছি, দেখুন এটা ফেসবুকে লিঙ্ক দিয়েছি।
আচ্ছা, লিঙ্কটা স্যার পরে আপনি হোয়াটসঅ্যাপে দেবেন কি আমাকে একটু? লিঙ্কটা হোয়াটসঅ্যাপে দিতে পারবেন?
হ্যাঁ, আমি তো হোয়াটসঅ্যাপে হ্যাঁ দিচ্ছি, আপনাকে দিচ্ছি।
সবাইকে রিকোয়েস্ট করবো এখনই যদি লিংকে ফিডব্যাকটা দিয়ে দেন, তাহলে আমাদের ম্যাক্সিমাম 5 মিনিটের মধ্যে আমরা ব্যাপারটাকে আপনার
ফিডব্যাক কি এখনই ফিডব্যাক দিব?
হ্যাঁ, বেটার হবে, কারণ ম্যাডাম প্রোগ্রাম শেষ হওয়ার পরে কেউ আর মনে রাখে না, সবাই নিজের কাজে ব্যস্ত হয়ে যায়, তারপরে ফিডব্যাক পাওয়া যায় না।
মানে বুঝতে পারছি না সবাই পারবে কিনা, আমি নিজেই পারবো কিনা, কিভাবে করব ফিডব্যাকটা?
জাস্ট আপনার যে লিংক।
আচ্ছা, হ্যাঁ পেয়েছি, লিংক পেয়েছি। তো লিংকটা আমি সবাই এখানে যারা আছেন আমি শেয়ার করে দিচ্ছি। তারপরে কি করতে হবে?
জাস্ট লিংকটা আপনি চলে যাবেন ফেসবুক পেজে, যেখানে আপনাদের যে প্রোগ্রামটা হচ্ছে।
তো যারা আছেন যোগেন্দ্র স্যার, তনুশ্রী চৌধুরী, আমি সবাইকে দিচ্ছি, লিংকটা দিচ্ছি।
ওই লিংকে আপনারা গেলেন, দেখবে আপনাদের যে আজকে প্রোগ্রামটা হচ্ছে সেই পোস্টারটা শেয়ার করা আছে, ওখানে আপনাদের কমেন্টসটা ইমিডিয়েটলি দিতে পারবেন, কোনো অসুবিধা হবে না। সন্দীপ ম্যাম, আপনি একবার ক্লিক করুন, তাতে হয়তো আপনিও বুঝতে পারবেন যে কিভাবে আমরা চাইছি ব্যাপারটা, তো ওরাও ব্যাপারটা আন্দাজ করতে পারবে।
হ্যাঁ, শামু স্যার আপনাকেও দিচ্ছি আমি লিংকটা।
দিয়েছে ওই লিংকটা।
আচ্ছা, এখানে গিয়ে তো লাইক করলাম, আর কি করব?
কমেন্ট দিন ওখানটায়, কমেন্ট।
সবগুলোকে।
সবাইকে আমি লিংকটা দিয়েছি, সবাই একটু গিয়ে আপনারা লাইক করে একটা কমেন্ট দিয়ে দিন। এখানে যারা আছেন আমি দিয়েছি লিংকটা।
হ্যাঁ ম্যাডাম, করে নিয়েছি।
হ্যাঁ স্যার, আপনি
হ্যাঁ আমি দেখতে পেলাম যারা যারা হয়ে যাচ্ছে তারা লিভ করবেন।
আচ্ছা
সন্দীপা ম্যাডাম আপনি হয়ে যান, যোগেন্দ্র স্যার ছাড়তে পারেন।
নেটের প্রবলেমের কারণে ওই মিডিল তো কিছুটা জায়গা হয়নি রেকর্ডিং আমার, আমি তো
আচ্ছা
পারিনি করতে।
ঠিক আছে, সেটা হয়েছে, অসুবিধা নেই, আপনি এটা ফরওয়ার্ড করে দেবেন তাহলেই হবে। যাদের হয়ে যাবে একটু বলবেন, তাহলে আমাদের সুবিধা হবে বুঝতে। যদি কোনো অসুবিধা হচ্ছে দিতে সেটাও বলবেন, তাহলে আমরা সেটা অ্যারেঞ্জ করতে পারবো। অনেকে আজকে জয়েন করতে পারেনি খুব সম্ভবত, মনে হচ্ছে ম্যাডাম, না?
হয়তো নেটের প্রবলেমের জন্য।
হুম। আশা করছি বাকিরাও রেসপন্ড করছে। এখানে আমি দুটো কমেন্ট দেখতে পাচ্ছি এখন পর্যন্ত।
আচ্ছা অঙ্গনা তুমি আমি একটা লিংক পাঠাচ্ছি, তুমি ওই লিংকে একটা ফিডব্যাক দিয়ে দাও, ঠিক আছে? অঙ্গনা শুনতে পাচ্ছ? অঙ্গনা দাস।
হ্যাঁ ম্যাডাম, হ্যাঁ।
তোমার হোয়াটসঅ্যাপটা চেক করো।
আচ্ছা আচ্ছা
ওইখানে ক্লিক করে একটা ফিডব্যাক দিয়ে দাও।
আচ্ছা ঠিক আছে ম্যাডাম।
সুপর্ণা হ্যাঁ তুমিও একটা দিয়ে দাও ফিডব্যাক। তনুশ্রী তোমাকে দিয়েছি কি না?
উনি পেয়েছেন, উনি দিয়েছেন, মেসেজ করেছেন। তনুশ্রী ম্যাডাম আপনি চাইলে লিভ করতে পারেন, উনি মেসেজ করেছেন।
ওকে, থ্যাংক ইউ।
তনুশ্রী চৌধুরী।
সুপর্ণা ভট্টাচার্য।
হ্যাঁ ম্যাডাম।
হ্যাঁ আমি একটা লিংক দিয়েছি হোয়াটসঅ্যাপে,
আচ্ছা
ওই লিংকে গিয়ে একটা তুমি ফিডব্যাক দিয়ে দাও।
ঠিক আছে।
একটা লাইক আর একটা কমেন্ট দিয়ে দিও। পূজা কি করে দিবে? পূজা তো রাজলক্ষ্মী, তুমি দিতে পারবে? আমি ডিজিটাল ক্লাব গ্রুপে পাঠাবো, তুমি ওইখানে গিয়ে দিতে পারবে? দেখো তো পারো কিনা, তোমার মাকে বা বাবাকে দেখাও। দেখো ডিজিটাল ক্লাব গ্রুপে দিচ্ছি, তুমি ডিজিটাল ক্লাব গ্রুপে আছো তো?
ইয়েস ম্যাম।
হ্যাঁ ওইখানে তুমি যাও, গিয়ে লিংকটাতে ক্লিক করে একটা ফিডব্যাক, তোমার এই অনুষ্ঠানটা কেমন লাগলো একটা কিছু লিখে দাও। ভেরি গুড, এক্সিলেন্ট এরকম লিখে দাও, ঠিক আছে? নাজমুল তুমিও দিয়ে দিও ডিজিটাল ক্লাব গ্রুপে দেখো একটা লিংক পাঠিয়েছি ওটাতে ক্লিক করে ভেরি গুড এক্সিলেন্ট এমন কিছু দিয়ে দাও লিখে দাও
অপর্ণা ম্যাডাম এখন পেয়ে গেলাম, উনি লিভ করতে পারেন। অপর্ণা ম্যাডাম চলেও গেছেন মনে হয়।
ম্যাম লিংক পেলাম
অঙ্গনা
না।
দাস ম্যাডাম দিয়েছেন।
হ্যাঁ অপর্ণা ভট্টাচার্য ম্যাডাম এসছেন আগে।
হ্যাঁ অঙ্গনা দাস ম্যাডাম পেয়েছি আপনারটা।
হ্যাঁ
একটা ব্যাপারে ভালো হয়েছে, আজকের ব্যাপারে এটা তো সবচেয়ে খারাপ হয়েছে, কেউ পারে না। ও বিষয়
হ্যাঁ এখানে অঙ্গনা দাস, অপর্ণা ভট্টাচার্য ম্যাডাম, তনুশ্রী চৌধুরী, যোগেন্দ্র দাস স্যার আমার আছে।
এটা 12 হয়ে যেত, এটা তো কেউই পারছে না, কোনটাই 14 হয়ে যেত, মানে সবই 12 12 10। ওই যে পরীক্ষাটা যে বেড়া লাগছিল এটা মাহি খে
আরে ওই জিমেলটা আছে মাহি @gmail.com
সিনস নি মাহি রে
আরে সিনস তো আমার মাহি বাইরে গেল মাহি
এটা তো আগের প্রশ্নটা ভালো আছে।
আরে আগের প্রশ্নটা তো সুদা আছে রাস্তে কোন দিছে
বা আমি ভাবলাম কিছু দেখাইবো কইব বোধহয় তোকে নিজের বইপত্র লইয়া পড়া দিয়েছে।
ম্যাম আমাদের এখানে 7টা বেজে গেছে, আমি আর এটাকে লিঙ্গার করবো না। বাকি যারা আছে তাদেরকে একটু বলবেন, তাহলে আমাদের ফিডব্যাকটা যেন আজকের মধ্যে করে দেন বেস্ট হয়।
ঠিক আছে আমি সবাইকে লিংকটা দিয়ে দিব, ফিডব্যাকের জন্য বলবো সবাইকে। আপনাদের কেউ দুজনকে অসংখ্য ধন্যবাদ, দেবাশিস চক্রবর্তী স্যার আর মাঝি কি মাঝি ছিল জানি ভুলে গেলাম, হ্যাঁ হেমন্ত মাঝি স্যার, আপনাকে অন বিহাফ অফ ভঙ্গুর ক্লাস্টার ধন্যবাদ জানাচ্ছি। আগামীতে আবার দেখা হবে সেই আশা রেখে আজকের মতো আমরা এখানে বিদায় নিচ্ছি। ধন্যবাদ, শুভরাত্রি সবাইকে।
শুভরাত্রি। সন্ধ্যা ম্যাডাম আপনাকে অসংখ্য ধন্যবাদ আমাদের এই ছোট্ট সুযোগটা দেওয়ার জন্য, যাতে করে আমরা আপনাদের জন্য কিছু করতে পারলে ভালো লাগবে। যদি আপনার বাচ্চারা যদি শিখে থাকে তাহলে আমরা বেশি আমরা উপকৃত হব। আপনাকে অসংখ্য ধন্যবাদ, ভবিষ্যতে আবার দেখা হবে আপনার সাথে।
আচ্ছা স্যার, আর ইনক্লুসিভ এডুকেশন নিয়ে একটা প্রোগ্রাম আমাদের সাথে হতে পারে, দেবাশিস স্যার লেফট করেছেন, হেমন্ত মাঝি স্যারকে বলছি ইনক্লুসিভ এডুকেশনের নিয়ে আমাদের সাথে আপনারা একটা কিছু প্রোগ্রাম করতে পারেন, একটা কিছু প্ল্যান করবেন আর কি। ঠিক আছে, ধন্যবাদ সবাইকে, শেষ করছি আজকে।